All right, good morning, everybody. I know there's going to be some people filing in still, but I want to be cognizant of everyone's time. So we're going to go ahead and get started. Welcome to the June edition of the DuPage ROSC presentation series. I was looking at our playlist. I think this is number 7. So we've got like a full half year of presentation so far, which is pretty awesome. And we've got a lot more coming this year. So we're excited to have everybody. Just a couple of quick housekeeping reminders. If you don't mind just making sure you're muted unless you're talking. There will be time to talk at the end. Actually, I think there'll be some pretty decent discussions at the end of today. But let's just make sure we stay muted. If you'd like, you can put your name and contact info in the chat. That's the best way to stay connected with everybody. So if you want to put maybe your name, an organization if you're from, and some contact info, and that would be great. Before we get into it, I do have a few things to share. So give me just a minute. I'm going to pull up a screen for us. All right, so I wanted to go over some of the upcoming meetings and events that are going on with DuPage ROSC. We got quite a bit coming up this summer. First off, the next DuPage ROSC Council meeting, which is Wednesday, July 12th, so next month. We are going to be talking about medication-assisted recovery and peer recovery support. So we're welcoming April and Mark from Greater Family Health, who have been great friends to the ROSC since we started. That should be a great conversation because medication-assisted treatment and recovery is like a ever-evolving part of recovery and part of the work we do. And as someone who likes to speak from experience, I personally was on medication-assisted treatment a few years ago, and the amount of recovery support that's been added to it is night and day from when we kind of first started doing this type of stuff. So that should be a really, really interesting conversation. So we hope you can make it to that one. I don't change the Zoom info on those council meetings. So if you have that saved from previous meetings, you can just reuse it. So we hope to see you at that one. Speaking of the summer, I just wanted to kind of update on some stuff that's coming up. So for the ROSC Council presentations, like we said, we're talking about MAR and July. August 9th, we are welcoming folks from the organization End Overdose, which is a pretty amazing group doing work in that field, to talk a little bit about Overdose Awareness Month. We'll also have more information about the 2 overdose awareness events that we're doing. So we can fill everybody in on that. September 13th, we got Greg from the Drug Enforcement Administration. Does a great presentation actually on like counterfeit pills and things like that. And it's super informative. And we're excited to have him here for that. The next couple of ROSC presentation series, July 19th, which is the next one. And I'm sorry, could everyone mute if you've not muted? July 19th, we actually have open right now. So if anybody is interested in doing a presentation, feel free to let me know. Usually just ask it something that maybe people are kind of passionate about, different area of recovery related stuff, just to kind of give us some more time to dig into stuff. At the ROSC Council meetings themselves, we usually only have about maybe 15 or 20 minutes for guests. This allows us to actually dig a little bit deeper and kind of have some further conversations about stuff. And then August 16th, we're actually talking about sex addiction, which is kind of an underrepresented portion of people who are dealing with addiction and recovery. So I'm actually really, really excited to have that presentation on the 16th. As always, I'm always booking. So if anyone's interested in coming to present for us, let me know. We'd be thrilled to have you. This Friday, I think I've pitched some of this to some of y'all, and some of you RSVP'd already. In coordination with Nature RX and the Conservation Foundation, our ROSC and RCO is doing a nature therapy walk and forest bathing experience right over here near Serenity House at Churchill Woods Forest Preserve. So that's in Lombard. As I said at the meeting last week, a bunch of ROSC members went and did this a couple of months ago and had a really, really amazing time. It's a very mindful and kind of grounding experience. And we left there feeling a lot more wellness, I could say that, and especially when we're looking at things like mental health wellness. So it's a really fun experience. It's open. So I'm taking RSVPs. I'm probably going to keep taking them for maybe like another day or two. So this is something you're interested in, RSVP to me, and we'll make sure that you get out there for that. But that's Friday at 2 p.m. And then lastly, our RCO has our virtual Narcan training. This is the third Thursday of every month. If anybody needs it, we have information on the DuPage RCO website, which is dupagerco.org. You can always go and check that out. Sometimes we have one person, sometimes we have 8, but we're there every month doing it for people that need it. So that's kind of some previews of things that are coming up. I'm gonna go ahead and stop share here for a bit. And again, if everyone can just make sure you're muted, because we're about to get to our presentation. So I met our presenter, Steve, what was it? Maybe like the first month that we started doing work with the ROSC. I think we met at the Hope Task Force meeting. And Serenity House / DuPage ROSC had been doing some work trying to find some funding through the Hope Task Force. And Steve was also there for the same thing. So Steve and his father, Steve Stefani, Roger Stefani, have a harm reduction organization called Hope for Healing. They've been doing work kind of in the Chicagoland area, but trying to get more into DuPage for the past couple of years. I'm going to let him tell kind of the history of things, but he's been a really good ally for the work that we've been doing. Great partnerships and opportunities to work together, especially in the area of like Narcan vending machines and harm reduction work as we kind of expand it into DuPage. So I'm happy to have him here to talk a little bit about his own experience in starting an organization, but also about, harm reduction in general, and how does that kind of fit into the recovery process. I think there's a lot of misconceptions about harm reduction. I think that what one person thinks harm reduction is might be something completely different from what it really is. And I think there's sometimes a lot of scare tactics, and there's a lot of kind of headlines that we see that don't really reflect the work that's being done in the harm reduction space. So Steve, happy to have you here. I'm going to go ahead and stop talking and turn it over to you for a bit.
Oh, sorry, I froze for a sec. Sorry about that. I froze.
That's okay. We can see you.
Okay, good. All right. Okay, to get started. So why I do what I do is I lost my twin brother in April of 2015 to a heroin and fentanyl overdose. Oh no, am I freezing again? Am I good?
Yeah.
Okay.
You haven't frozen at all.
Okay, perfect. Okay, so when we looked at the space of the nonprofit world, we just decided that harm reduction was one of the few places where we could, truly make a difference with a small family foundation. And early on in the process of trying to develop a nonprofit, we met Chelsea Laliberty from Live for Lolly, and just kind of learned the harm reduction model from them. And they've been a huge help in us starting our organization. But here, I'm gonna start the PowerPoint. Sec. All right, so what Hope for Healing has done in the past several years is initially we contracted with Live for Lolly and brought their harm reduction mobile unit out to West Chicago. And we did that with a grant through the Hope Task Force. And initially that was not the most successful harm reduction endeavor. And since then, we've had to kind of step back and go, what is different about DuPage County than the other counties in the surrounding Chicagoland area and Chicago itself. And I think the largest difference that we've seen is that drug use in DuPage County is very hidden. It's pretty hard to, for example, in Lake County or in the city, if you bring a harm reduction truck out, if you build it, they will come. It's definitely not the case in DuPage. A lot more use inside of houses. A lot more, I would say, stigma, really, that is, preventing people from, seeking harm reduction services, which is why, we want to partner with the DuPage ROSC on the Narcan vending machines and whatnot. But anyway, my main topic today is going to be how harm reduction fits into the context of the larger treatment model. I think this is a really important topic because when I initially stepped into the space, there were definitely a lot of misconceptions, a lot of stigma about harm reduction work. And I found that, a lot of times treatment providers saw it as either enabling or, that we were maybe discouraging people from getting to treatment. And so I want to dispel some of the misconceptions that come along with that. So first of all, what is harm reduction? And harm reduction is the philosophy of taking measures to reduce harm in our everyday behaviors. Wearing masks, seatbelts, and condoms are all widely accepted forms of harm reduction that we've had in our society for a really long time. And in the context of drug overdose, harm reduction can involve distributing Narcan, distributing fentanyl test strips, or drug checking, which is the ideal with a spectrometer. And then the distribution of clean supplies. And in a few places, it involves safe use sites. Now, that is not the case here in Illinois, although I do know that there are some people working very hard in the Illinois Harm Reduction Coalition to pass some laws on that. All right, so harm reduction and treatment models. So I think it's in pretty much every treatment model, there's this acknowledgement that relapse is part of recovery. I've seen a couple different studies on this, but one study that said 7 and one study that said it took the average person 9 trips to treatment to maintain long-term sobriety. So for the average person seeking treatment, relapse is almost inevitable. There are obviously cases where people are going through treatment one time and being able to maintain long-term sobriety, but the data is showing that that's not the case for the average person. And people with substance use disorder are much more likely to be successful in treatment when they're ready for recovery, which is a very big part of how the harm reduction model works here. And I will explain that a little bit further on some of these further slides.
Hey, Steve, real quick.
Yes.
I'm still seeing just the first slide. I don't know if that's gone through. Didn't mean to interrupt you.
All right. It does that sometimes. Let's see.
You could probably just do it from there too. There
Is this okay? So that was okay. I'm on my third slide now. All right. I think it's important to acknowledge so that there's this increased danger now during relapse. So most addiction recovery models are created well before the advent of fentanyl. And the risk of accidental overdoses increased significantly because of this. I think, most of us have seen that, toxicology reports are coming back after, people overdose with, fentanyl and all different types of substances. And overall, we know that abstinence is the ideal when it comes to recovery. But once again, the data is showing that an individual who's seeking treatment is going to have very high risk for relapse, and as a result, a much higher risk for overdose than they used to have. And so that's part of the reason that these sorts of services are important at this point. And I think another thing that we need to bring up here. So in DuPage County, the Hope Task Force had the DuPage County Drug Enforcement do a presentation a couple weeks ago, or I guess months ago at this point. But what they showed was that in DuPage County, the drug that is most often seized is cocaine. We know that there's a decent amount of people who use cocaine only a couple times a year. Whether it's concerts, music festivals, or bars or nightclubs, the risk for accidental overdose from a casual user who is not going to be part of the treatment infrastructure is much more common. And that's why there needs to be things like fentanyl test strips available at large gatherings. And additionally, Narcan needs to be available in any sort of large gathering. So that is why, and this is kind of a term that Jarrett and I have picked up from the DuPage County Health Department, is that Narcan needs to be part of the first aid kit of the 21st century. Drug overdose, I believe it was in either 2021 or 2022, became the most common form of death for people under the age of 50. And because of how commonplace this is, CPR protocols have changed. So now, when a responder comes across an unconscious person, they are supposed to assume that they have overdose. And if we are acknowledging that this is such a, significant crisis, and that, it's being baked into the model of how we, address people who have we find unconscious. Clearly Narcan needs to be in the first aid kits of every, any place that has a first aid kit and B, a defibrillator, for example, even like pools or, I think, what was the story recently, that graduation ceremony in Tennessee, you never know where it's going to happen. And honestly, at the end of the day, why take the risk? When we know that we can get Narcan into people's systems before first responders even arrive. And that's really, one of the most important aspects of harm reduction. I remember early on, Chelsea, when she was showing me how harm reduction works, always made a point to say that we need to saturate communities with Narcan. It needs to be in the hands of people who are using drugs. It needs to be in the hands of people who are in recovery, and it needs to be in the hands of anybody who's running any sort of event. Now, within the recovery and treatment model, there are definitely ethical concerns, right? Harm reduction strategies have often been viewed as enabling, and at the end of the day, if it is done irresponsibly, it can be enabling. And so there are a couple precautions that a responsible harm reduction program needs to take. So first of all, harm reduction programs need to be careful in how and where they operate to avoid enabling people in recovery. This means that harm reduction programs that provide clean supplies or safe use should not operate in the same location as rehabs. This is something that actually Jarrett and I have discussed before, because, as much as Serenity House has been open to us doing, work with them and around the area, we decided that, for example, bringing a harm reduction truck to Serenity House was not the most responsible decision, because we don't want somebody walking out of meetings and seeing that temptation that we don't want to trigger anybody. The other, and I think this is honestly the most important aspect of a responsible harm reduction program, is that they use a process called motivational interviewing, that is going to direct participants towards treatment in a non-coercive manner. So earlier I mentioned that people who are ready for treatment are going to be much more successful in treatment. There are cases of people getting forced treatment where it works, but unfortunately those are pretty few and far between. And so harm reduction is just looking at it in a different way, in the sense of, we need to keep people alive when they relapse, and we need to create a situation in which we show people who are in active use that we care that they're alive, we develop relationships with them, and we motivate thinking that is going to get them back into a place where they want to, whether it is reduce their use or get into treatment. We want to motivate that. And how motivational interviewing works is, it's a dialectical process in which you're asking questions. So it can seem, if you're having a conversation, it can seem like you're just kind of checking up, but you use leading questions that, lead somebody back to, oh, maybe this would be a good idea. And besides that, you just make it clear that, hey, I have connections to several different types of treatments, housing services, medical services, whatever it may be. But that, at the end of the day, we know that people that aren't going to are ready to take those steps, they might need some more time. And honestly, at the end of the day, showing compassion and harm reduction, as we would say, meeting people where they're at, is incredibly important. So yeah, it's basically just the way that I look at it is our program is there to supplement treatment in the way that, we want to keep people alive and we want to, funnel them into treatment. And so, yeah, the key takeaways here are that harm reduction can fit into the larger treatment model by playing a role of supporting individuals who relapse and help them stay alive so they can get back into treatment when they're ready. Harm reduction can help casual users take the necessary precautions to avoid accidental overdose, and a responsible harm reduction program will take measures to avoid enabling use and will funnel participants into treatment and the services needed to help them get back on their feet. And that is all I've got in my
Steve, I got some questions. First, would you tell people about everything that you carry on your truck? Because I think that's part of the problem too, is because harm reduction can sometimes be a broad term. Like I said, what one person thinks of harm reduction might just be like Narcan or something, but it's more broad than that. So can you tell everybody like the type of stuff that you carry when you're going out to do the mobile use? Did you
Sorry,
hear
you're
any of
freezing
that?
a little. No, I'm sorry.
That's okay. I just asked if you could tell people all the stuff that you carry like on your truck. So when you go out to do, mobile stuff,
Yeah,
what are all the things that you bring with you? Because, and I'll just repeat it. I think people's concepts of harm reduction are different. So someone might just think that means carrying Narcan, right? But it means like a whole
yeah,
lot more than that. So what's everything that someone could get if they come to see you at a mobile site?
sure. Um, okay, so the things that are provided on the truck are Narcan, fentanyl test kits. So in those kits, it is usually about 5 fentanyl test strips, 2 small cups, and just the right amount of water to do the testing. Then there are clean supplies. Now this is the part where we really think about meeting communities where they're at, if that makes sense. We want to meet individuals where they're at, but we also want to meet the communities where they're at. And so in DuPage County, we've only really done clean needles, but clean supplies can also include snorting kits and smoking kits. And the reason for those is when somebody is smoking crack or snorting, there are still ways in which bloodborne illness can be transferred, and I think it's something that doesn't get talked about very much, right? Whether it's nosebleeds and the increased capillary activity in your nostrils, or the cracking of lips. There are a lot of different ways in which bloodborne illness can get transferred. So that's the purpose of those. But additionally, the truck has a lot of other supplies. So for example, I mentioned earlier condoms being a widely accepted form of harm reduction. So there are generally condoms on the truck, as well as toiletries and snacks. Usually I like to have bottles of Gatorade specifically. And the reason for that, obviously it's nice to get some people some electrolytes and whatnot, but also it is a responsible way for disposing of syringes. So, when you're done with your syringes, you put them in the bottle and then you dispose of the bottle. So teaching people techniques like that to, once again, avoid a lot of the harms that can come from use. Um, and then, if it's winter, sometimes we've got jackets that have been donated. Uh, we had a lot of backpacks for a while. Just, honestly, it's usually a rotating thing of just general supplies that we give people to, maybe help their life be a little more comfortable.
I got a few more questions about it because so I went to go visit the truck, and I've been to other harm reduction sites, along with people, and I guess this is also like my blind spot too. I'm in recovery. I got sober using an abstinence model, and I work for a place that uses an abstinence model. So all I've known for a few amount of years is the abstinence model, right? So some of this stuff, as you're learning it, there's like some cognitive dissonance in your head because you can understand how it would work for people, how it can keep people alive, but you're also like, well, you know, maybe they'd have a better chance of recovery if they were just completely separated from stuff. And that's my bias, right? That was the bias that I saw going into this stuff. But you told me something when we went out to visit. I think maybe before we went, which was, I think I asked you, so what do you do for people to like help them like find resources? And I believe you said something like, well, we don't lead with that, right? Like we kind of wait to establish some conversation and relationships with people. And then that's how it kind of works. So tell me about that process. I don't know if that was something you had to kind of learn to do.
It
Um,
was, yeah. Um, I would say what we like to use is like a person first model, in the sense that it's like you want to develop like an interpersonal relationship first. A lot of it comes from, I'm going to ask about your life. I'm going to ask about, how, I mean, sometimes it's just as simple as starting with how's it going. And you know what? There are definitely some people who are going to come that they're just going to want to get their supplies and leave. Um, but at the same time, it's like, trying to engage people on an interpersonal level, um and start from there, because I think when we think about non-coercive models, the most important thing is to, even though unfortunately it's like I do have an agenda, I don't want to put my agenda first. I want to put I care that you're alive first. And just treating people like they're just generally human beings, which unfortunately we're talking about a population of people that is largely dehumanized in their everyday life. um I think that especially when people are very deep in their addiction, whether it's even just somebody who owns a shop or family members or whatever it is, there is definitely like a dehumanizing element to how people are treated. And I think people who are deep into recovery, so they've relapsed, overdosed a lot of times. I understand where some friends and family are coming from, where there is sometimes this loss of trust. The studies have shown that it's like if somebody goes deep into addiction, like their narcissistic tendencies are going to be increased, and that is not their fault. But at the same time it does cause this mistrust, and it's just really important to be like, hey, you know what, I trust you. You know what I mean? Like I want you to be alive. I feel like it's like, helping people kind of take ownership and slowly realize, okay, like, yeah, I do need to, maybe make some changes. And sometimes those changes aren't going to be immediately going to treatment. It might start with, one I hear a lot is just, I'd like it to be a little less. Or I'd like this to not rule my life as much as it does. And so, you just take any little kernel like that and you ask questions about it.
yeah. Um, I know one, and I'm sure there'll probably be some strong opinions about this one. One of the things that came up in some of the House bills and things like that were coming around this way is like safe consumption sites.
Uh-huh.
So, safe consumption sites, there's a couple, I believe, in the US right now, right? There's one in New York, and I believe there's one in Philly, but then also on the West Coast, kind of towards Canada.
Yeah.
And it took me a minute to like cotton to that idea, because if all you're seeing is the headline about it, all you're seeing is like they're giving people basically a place to use drugs, right?
Yes.
That's kind of the uneducated look at it. But if you go
Yeah.
and actually look at the work that they're doing at some of these sites, you can see like, no, I mean, they're basically just trying to make sure people aren't dying, right? They're trying to
Yes.
humanize people, make sure they're not dying. And I know that we, and maybe Felicia can mention this too, because she was in a lot of the legislative stuff, but they were talking about putting one in Chicago, and they're trying to find neighborhoods, right? So they want to find neighborhoods where they could have places like this, and where it's needed too, right? They want to find out where the users are, and even in those neighborhoods, there's still pushback, right, from the residents, because they don't want some of this stuff in their
Yeah.
areas. So it's
Sorry,
a really tough
you're cutting
conversation.
out a little bit again, but I can speak to the safe use site bills and whatnot. So I know that yeah, like you said, the first time you hear something about a safe use site, it does sound like a very, very uncomfortable sort of subject to bring up. Um, I think that it's important to understand that like I was speaking about motivational interviewing and basically bringing humanity back to the process of uh, helping people who are in active use, who are maybe not ready for treatment. And yes, it is preventing people from dying. They would be. It's not just like a place to use drugs. There is a lot of services linked to those organizations. And B, they're in the presence of medical staff that are going to be there to be able to respond. Not only is this something that is preventing a lot of overdose, and I believe thus far there are 0 overdose deaths in safe use sites. I think the other aspect of it is that, how do I explain this? So when it comes to safe use, these are not just sites that are specifically for safe use. There are a lot of different things that are going to go on. It's kind of like the stigma surrounding where, like, if you ask the average person, what does Planned Parenthood do? They're going to go, oh, yeah, they do abortions. And it's like, no, they do a whole range of services. It's kind of a similar sort of deal. Actually, I do know that the Illinois Harm Reduction Coalition is going to be putting together an overdose awareness event on August 28th in Federal Plaza in Chicago. And the Chicago Recovery Alliance is going to have a mock safe use site there to hopefully dispel some of the discomfort around it, and show that it has like a significant linkage to treatment. And I think that that's kind of the thing, once again, is that somebody who goes into a safe use site or somebody who participates in a harm reduction program, those are all what we would call points of contact. And a responsible clinician is somebody who's going to take advantage of that point of contact to create more good, right? We're going to want to create more change, link people to more services. So yeah, I think that when it comes to safe use sites, there is a lot of stigma, a lot of misinformation. And yeah, I think that it is a model that can work. I also want to point out that in cities that have safe use sites, they are able to streamline their overdose response model. So in terms of, I believe in the New York one, I'd heard that they saved the city about like $30 million or so within a year. But I think that also, there's another benefit to it, right? So we have now, it's not just emergency response teams that are responsible for all, accidents out there. It's like, this is teams of people that are directly responding to overdose. And so well, the word I usually use for this would be like triage, right? So we're building an infrastructure for triage for the overdose epidemic. And once again, I look at it as not separate things. I don't think that treatment and harm reduction are so different at the end of the day. I think it's one of those things where I think that the big mistake I heard a lot from people was thinking that an individual is going to choose harm reduction or treatment. And I think that, if we're responsible about it, this is a larger model that can all fit together.
I think what Jarrett was saying, too, though, is finding a location
Right.
that is going to be receptive to having this. I was privy to talking to legislators, and they were like, we're already a compromised neighborhood. We already have a bad reputation. Why do you want to put it here? Why don't you put it in a more affluent neighborhood? Like, it's going to be a struggle to find a location because people don't really want that in their neighborhood, especially when their neighborhood's already has a bad reputation for crime or drugs. To add that, and again, it's about education, right? But no, most people are not going to take the time to educate themselves that this is going to actually benefit the neighborhood.
Absolutely.
Yeah.
So. Yeah. And I feel like a lot of times the arguments that are against this stuff, there's like a common sense element that is kind of missing, because it is and I do think so. A lot of it does just come from misinformation, but there's just kind of this element of not understanding what the full model is, and sometimes like my common sense question would just be, so if there is a lot of open drug use in your community, wouldn't it be better if it was in a place where there was a level of supervision? Isn't that gonna, because and this is another aspect. I think people who are in active use, and especially if they're unhoused, are going to be exposed to a lot more potential traumas, whether it's being robbed, being dehumanized, what I mean? And so at the end of the day, it's like a lot of that crime and those elements can to some degree be decreased if we're able to kind of set up a safe use site and make that a more responsible process.
I think it's interesting because I feel like to a degree every city, neighborhood, whatever, still has a not in my backyard type of thing. I mean, we see it in DuPage all the time. As a team, and obviously Steve too has seen this, if you do outreach, even for basic things like Narcan training, which to us is a very basic part of harm reduction, right? That's like kind of one of the tent poles of harm reduction, is just making sure people know how to take people out of overdoses. We'll still get some looks sometimes from people, right? Like, would you like us to come and train you on Narcan? Or, hey, can we give you your local business some Narcan? And they kind of look at you crazy, right? Because they either think it's not happening, or they think that, by offering these types of things, that it's just kind of contributing to an ongoing issue that we have. And we've been going through that for the past year. A lot of opportunities come up, like, the health department is like basically, like jumping to try to find places where we can put Narcan takeaway boxes and vending machines and things like that. And you would think, right, that people would be knocking down the door to get these things. And it's just not the case. It's just not the case. And DuPage especially, really has an issue with that. Not only harm reduction related stuff, but like sober living. Some of these basics of recovery are we're kind of handicapped to a certain extent out here, which is ironic because we have so much money to put towards services and resources, but there's still those couple of things that they won't let us do out here yet.
Do you want me to speak on our project that we're
Sure.
working on? Yeah. So Hope for Healing and the Serenity House ROSC and I believe RCO are we're in the process. We're actually written the grant narrative at this point. We're just shopping it around. But our goal is to create a remote harm reduction program in DuPage County. And the idea being that we have vending machines in several locations, because as I said before, I've found out firsthand that it's pretty hard in DuPage to get a solid following of participants to come to the truck and deal with you in person. And so we feel like this is a model that is going to definitely reduce stigma. While at the same time, I've seen a lot of different communities in this country start to do vending machine programs. I think something that is, I don't think totally unique to us, but we have our own way of doing linkage to care, and that is our plan is to create a basically a hotline and text line where individuals can call in or text in and get linkage to care and services. Additionally, because of like we were talking about the stigma, safe supplies are not necessarily going to be able to be in those vending machines at this point in time. Hopefully down the line that changes. But so basically the hotline is going to serve to do delivery and mail programs if people do need safe using supplies, and then B, that the amazing team at the Serenity House ROSC is going to, or the DuPage ROSC is going to, get linkage to care and other services. And I know one of the things that the ROSC did that really amazes me is they created a manual of all of the resources in DuPage, and it is exhaustive. It's really great. And they also have connected so many individuals from treatment providers all over the state. And I'm sure a lot of you are on the group text. But yeah, I don't see a better model for linkage to care. And yeah, I trust your ability to get people to the right place.
Do you want to tell them the name? Are we still going with the name that we chose?
Oh, the naloxone.
Yeah. that was Felicia.
Yeah.
Great job, Felicia. Yeah, so that's coming up, but I don't know. We got a few minutes left. We don't have to go all the way to the hour, but I did want to open it up for any other comments. Maybe takes on harm reduction in our area or the area that you're in, and just any other questions you might have. I'm going to open it up for a few minutes.
Yeah, I'd like to add some stuff to this. First of all, thank you, Stephen, for your work and for your presentation. Thank you, Jarrett, for having this gentleman on. Harm reduction is a thing that, like you, Jarrett, I've had a kind of trajectory in trying to wrap my mind around it. I'm a person with lived experience, been called a crabby old 12-step guy. Abstinence was the only thing that was available to me. But I had a unique experience before I worked as a technical assistant of working in a court program, and not only just preventing death in terms of providing Narcan and all of that, but one of the things I noticed is many people in our court programs struggled to stay clean and sober. And, to talk to somebody about having a harm reduction program in a court system could be very helpful. I worked with many people who really wanted to stop, but couldn't quite put their fingers or their hands or arms around how they could do that, I've met, you meet somebody and they're using heroin, right? And they're just dying, and they get into a court program and they're still getting dinged for using weed or maybe having used heroin once a week instead of 5 or 6 days a week, and you want to give this guy credit. You want to give them something, things are improving. And, so one of the things that I think is really important to realize too, and I think this feeds into a lot of the work that Felicia is doing, in terms of getting law enforcement, court systems, city leadership, getting policy and laws changed to make this a little more acceptable and findable for people who need this kind of help, and to kind of lead people into an abstinent lifestyle. Or I don't know, man. I mean, I had people in the court program who were very heavy users of heroin, and they graduated our court program, and I would see them on the street and they would apologize to me because they're smoking a little weed now. And I'm like, dude, do you have any idea how far you've come? If all you're doing is smoking a little weed on the weekends, and you were like a daily user of heroin, living in an abandoned building on a burnt out mattress, man, I mean, it's still improvement, and we need to give encouragement to those people who are improving, who are making those incremental steps. When I reflect on my own life and my own experience, although abstinence worked for me, quite frankly, I relapsed every year for 30 years, so it didn't work. It didn't work until my life was in such a wreck. Oh, if I could have found something like a harm reduction program that might have been able to lead me along a little bit and get me to reduce a little bit, get me to think, get me to clear my head a little bit. Anyway, harm reduction is it. It's just trying to get this thing off the ground, to try to change policy, to try to change laws, to try to get people to stop being so narrow-minded about, helping each other. Anyway, I'm going to stop, or else I'm going to just go off.
No, you made it's a perfect point about it's. I always hear people say in the harm reduction model, any positive change. And you're right that when people can make any positive change, it does get them closer to a place where they're going to be ready to accept recovery. It's yeah. Thank you so much for your comments. It's really great to hear stories like that.
Even though I'm not I guess personal fan of methadone, I like Suboxone. Like if I had a choice to give someone some MAR, I always about harm reduction or anything, I always say, like, if Louis was alive on methadone, I would be really happy, because he has a chance that's harm reduction, right, to get to the place that hopefully he is substance free. But when a person's gone, they're gone. So I think people don't really understand that like, why are we saying it's okay? Why are we giving them, like, I don't think till you understand ultimately that death or jail is the end game, and this is something that could prevent those things. I don't think if you can wrap your mind around that, you're not going to really understand harm reduction, the common man, about education. So it's really hard to combat, but it's our job to combat it and educate people about it. I think one thing that might help is having people who've used harm reduction and used clean needles, who are in recovery and saying, I'm alive and thriving today because of those things. And people that are living successful, happy, productive lives to come out and speak about it. That's kind of hard still to do, as you guys know, Jared, trying to find a campaign of people to put their face on a poster. But until we have people really speaking out about it loudly, I think the stigma is gonna be something that we combat all the time.
Thanks, Felicia.
Can you guys hear me?
Yes.
So this is Nicole Jansen with RCA, and I just wanted to say myself and my coworkers have been trying to talk to hospital-based programs, social workers, nurses, people who work in behavioral health about harm reduction. And what I've noticed is when we do use that comparison to Planned Parenthood or just to sex education in general, it really seems to resonate because that's something that everyone has heard. Everyone has been through that at some point, even if it was, 20 years ago in junior high, that of course we know the best way to prevent unwanted pregnancy is abstinence. We also know that's not what people do. So, then we give them alternatives to try and help them, prevent unwanted pregnancy. So I love that comparison. I actually think it's really kind of spot on. And then the other thing that we kind of have been talking to, providers about is if you can't get through to someone, if somebody's saying, listen, I don't want to hear what you have to say about recovery, about me, stopping this use, that if you can at least give them harm reduction resources, that when they get there, and other counties, different counties have different resources, and some counties are further ahead of DuPage. But, trying to impress upon, especially the people in the hospitals, that if we can get the individual to go to some of these harm reduction sites, they will be given counseling there. They will be given the opportunity to hear about different recovery resources. So it's not just a necessarily like free reign to use whenever and however you want. And that I just did one with Edward Hospital last week, and it really seemed to resonate with the people in attendance. So I'm hoping that the more we can talk to people, the more the tides will turn.
Thanks, Nicole. Appreciate that.
Yeah.
Any other comments or questions or for Steve, or maybe just a take on harm reduction as you see it out in DuPage? Floor is yours for the next minute if you want it.
Steve, have you felt like there's progress in DuPage County a little bit?
I think you might have frozen. I'll re-ask. Steve, do you feel like there's progress being made in DuPage County that you've seen?
Yes, it's
Be honest.
a little slower. It's definitely a little slower than it has been in other communities. And, honestly, when my family got involved in this, we wanted to be kind of the smiling family behind harm reduction, if that makes any sense. Like, just kind of an example of, and honestly, my dad is a neuropsychologist, and we kind of like lean into that a little bit. And like, hey, like we're legitimate. We're not, we're not flying by the seat of our pants here. Which I think, sometimes gets, that's the impression I think people got initially from harm reduction models. I have seen a tremendous shift in, like, for example, the Hope Task Force. I remember my first Hope Task Force meeting. When we got up to explain what our goal was and what we were trying to do, like the room got silent. And then there was a good amount of pushback. The last Hope Task Force meeting I went to, or I guess not, two Hope Task Force meetings ago, they were almost exclusively talking about harm reduction. They're bringing up, Live for Lolly, Chicago Recovery Alliance, Hope for Healing. I am seeing a massive difference in terms of the intentions and the attitudes. I would love to see this turn into more action, which is, I think what we're working on now is just we need to get the money for it, which has been more frustrating than I would like to admit. But besides that, I think that, this is what I would say is DuPage County is in a very diverse county, but it is in many ways a very classically suburban area. And I think that, when it comes to cities, the models are there, they're easily reproducible and whatnot. I feel like the next step, at least for our area, is figuring out what is a harm reduction model that is appropriate for a suburban area, which is really, really what we're trying to work on now with this new project. because, you know, I believe that, you know, if we are, you know, able to get a successful number of participants and we're able to, you know, have utilized the ROSC and their ability to get people into, you know, treatment and other services, I feel like I'm very hopeful about our idea and what this could mean for models for the suburbs in other areas that are similar.
Well, Steve, thank you for the presentation. Always love doing work with you. If anybody wants to
Likewise.
find you online, can they find you at, what's your website? Are you using the website or Facebook or
Well,
something?
I mean, we have hopeforhealing.org. We have our Facebook. I'll put it all in the chat, but, and also
Okay.
I'll put my email again.
And I can follow up an email with contact info and stuff like that. So yeah, if anyone's interested in getting on board with the naloxone zones, let us know. We're gonna need some help with that. Or if you know anybody that maybe has a site where they would like a Narcan cabinet or something like that, just let us know, because that is coming down the pike and we're looking for site partners. And the important thing is you don't have to do anything. You don't have to pay for anything. The installation, the maintenance, the refilling, the resource brokering, that's all taken care of through funding. So we're really just looking for people that maybe kind of are thinking a little bit more progressive about having harm reduction on their sites. So if you know anybody, let us know. Steve, thanks again, man.
Well, thank you. Thanks for having me.
And thanks to everybody for coming. Have a great month. We'll see you at the next one.
Thanks, Steve.
Hi, everyone.
Bye. Steve, great job. He's gone. We did it.